and warm greetings to everyone watching my video. This is me Durshana Chetri and I'm going to discuss an important topic which is people living with major depression. Did you know that the depression is a leading cause of disability? So let's get started with what is depression. Depression is a common mental illness characterized by depressed mood, sadness or loss of interest in activity. It is also known as clinical depression. In normal life, it is normal for human beings to sometimes feel sad, upset, and lack of energy. But people with depression often have these experiences for longer and prolonged period of time and can be present every day for at least 2 weeks. Major depression affects people with all ages, so it doesn't discriminate between the ages from teens to children to older adults and to the elderly population. The main aim of this webinar is to highlight the experiences and challenges faced by people living with major depression and also discuss the nursing intervention to manage depression and at last one organization to get help from. Well, depression is a complicated illness to understand. Unlike other illness, we cannot see the physical symptoms, like there is no physical symptoms like rashes, fever, headache, redness, etc. Hence, it makes it harder for people to understand or also for healthcare professional to identify whether or not the person is suffering from depression. Major depression is not just a bad mood, and often people use the word depression like synonym to a bad day. Or a low mood, but depression is more than that, as it affects both physical and mental well-being of people. Therefore, it is vital to manage depression. It is a major public health issue. It is a constant sense of helplessness and despair, a sign of major depression. Major depression is characterized by depressed mood, sadness, or loss of interest in activities. So now I'm going to talk about incidents and statistics of major depression. According to the World Health Organization latest stats, over 280 billion people in the world suffer from depression. World Health Organization also predicts that depression will be number one health concern in both developed and developing countries by 2030. Depression is more common in women than in men. While in the context of Australia, according to the Black Dog Institute, depression is affecting 1 in 16 Australians, and 1 in 7 Australians will experience depression in their lifetime. Females are more likely to experience depression than males, like 1 in 6 female will suffer from depression, whereas compared to 1 in 8 men will suffer from depression. Depression is a huge economic burden to the country, with increasing rate of disability and reduction in productivity. According to Black Dog Institute website, depression has the third highest burden of all disease in Australia and third globally. Mental health is important to the well-being of individuals. The rate of major depression is rising among adults at a rapid rate, especially nowadays with the COVID-19 pandemic. Younger people of people mental health has been directly affected. In the US, according to the National Institute of Mental Health reports that 3.2 million people aged 12 to 17 years old have at least one major depressive episode within last 12 months, and a lot of people are suffering from clinical depression that they do not seek treatment, which means that there is a lot of suffering from major depression around the globe. Now I'm going to discuss about challenges of depression. We all feel low, stress, lack of energy and lack of motivation sometimes. It is important to know that we all can experience some of these symptoms from time to time, which does not necessarily mean that you are depressed. When such symptoms last for more than 2 weeks, it is a time to seek immediate help. Let's first know what causes the depression. There is no any single reason or cause for getting depression. There are a number of factors that leads to the development of major depression. Research suggests that long-term unemployment, living in a toxic relationship, living alone, loneliness, and work take some of the personal reasons like family history, personality, serious medical illness like asthma, diabetes, thyroid, and alcohol use can also trigger the depression, and life events like passing away of close family members can increase the risk of experiencing depression. It is important to identify an early signs of depression. So I'm going to discuss some of the signs and symptoms of major depression which I've extracted from Beyond Blue website. So behavioral changes are not going out being in a conflict relationship, the feelings like frustrated, unhappy, sad, disappointed, and the thirds like I'm a failure, it's my fault, nothing good happens to me, are the changes in thirds process. The physical symptoms that we can see is like tired all the time and lack of energy, change of eating habits, loss or uh, gain of weight in a significant amount, impact of major depression. Major depression has a major impact in our lifestyle. It is a mental disorder which affects both physical and mental well-being, difficulties to memory and decision making, negative self-talk and addictive of alcohol and drug use, loss of job, conflict in the relationship, and isolated from family and friends. Now I'm going to discuss about intervention of depression. Depression is a very common mental illness, but the good thing is it is treatable and manageable. It is very crucial to detect early signs and symptoms of depression. Treating depression early can help people to address problem quickly and prevent it from getting worse. Often depression is left unrecognized and untreated. A range of treatment and help is available. People living with major depression can feel anxious, lonely, or be ashamed of serious mental illness, which in return make it harder for people to get medical help, which we can see commonly in the society. The one thing we all can do is treating mental illness like a common illness. It is okay to have mental illness and ask for help. Early recognition of signs of major depression helps people to get better and enjoy their life. There are different ways to manage depression with different type of people, and also depends on how severe depression is. Different treatment will be helpful as per the need of people. Some of the intervention I am discussing today are medications. The medical treatment for depression is antidepressant medicine. It can be useful in the treatment of moderate to severe depression. Antidepressant helps relieve the symptoms of anxiety and depression. Doctor can only prescribe antidepressant medication. So other treatment we can discuss is psychological treatment known as talking therapies. It is one of the nursing intervention like providing emotional support and actively listening to the person and one-to-one conversations. So these are some of the nursing intervention that we can try to help the people who are suffering from depression. And some of the research have also found a strong evidence that talking therapies can be used an effective way for approaching people with major depression. So other changes like change in lifestyle, eating healthy food and exercising, and exercising is also a proven way to reduce stress and live an active life. Support groups and online forms, there are so many support groups like Beyond Blue or Helpline Australia, so where you can seek help, and there are online platforms like Black Dog Institute where you can get help for your mental illness. So now I'm going to discuss about one current Australian service initiative designed to improve care and reduce the impact of depression, that is Beyond Blue. Beyond Blue established in October 2020 and it is a non-profit organization. It established 20 years ago and is a member of Commonwealth of Australia. The CEO is Georgia Harman and the founder is Jeff Kennett. Beyond Blue is an Australian mental health and well-being organization. They provide support programs to address issues related to depression, suicide, anxiety disorders and other related mental illness, supporting everyone in Australia with the knowledge and skills to achieve the best possible mental health is the goal of Beyond Blue. Support is available 24/7 and you can call for support. The number is 1300-224-636. In conclusion, what I like to say is major depression is a serious mental condition. It affects how people think, feel and act. Depression is often not recognized and can be severe if untreated. It is important to seek for help or support when you detect early signs and symptoms of depression, and remember, feeling low, sad is a normal part of life, but if you are feeling down or low on a regular basis for more than 2 weeks, you will be dealing with depression. So remember, with depression, the early is the better. And at last, I really want to thank everyone for watching my video. Thank you everyone and have a nice day.